Welcome to the Health Update. I'm Madison Kasper. With me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is how HRV tracking helps us understand health, stress, and lifestyle. Dr. Raja, what is HRV?
HRV stands for heart rate variability. So HRV is actually measuring the time between heart rates. And in reality, naturally, there is a fluctuation between heartbeats, and that's normal and it's okay to have. But what an HRV tracker does is it actually measures that variability and then it tries to tie it to health and wellness. And this variability, while there, it's not something that you and I can just kind of figure out on our own. You need these kind of very unique devices that can pick up these little variations.
Why is tracking it so important for overall health?
What they're noticing is that they're trying to relate that to, can the variability give us an indication in terms of how anxious the person is or how stressed might the person be? And if the variability can give us that information, what can we do with that information? Will we be able to change the way we behave, change our stress factors, and thereby maybe make our day-to-day life a little less stress-free, or less stress, therefore better for us?
Now, I know people that have these apps that help them track HRV.
Correct.
So what apps and how does the app track it?
So these devices are measuring that interval between the heart rates. And they usually, for example, this can be done in a hospital. So usually when people go to a hospital, they get something called an electrocardiogram, which is an EKG, which does exactly that. It monitors your heart rate. But when physicians do it, they do it over, for example, they'll make you wear this monitor, and they'll monitor your heart rate over like a day, for example. So many minutes, many hours. And that tracking of what is the heart doing is an indicator of how stressed out the system is. And now we have transitioned from, instead of having to go into the hospital to do this, there are now devices that people can wear, and that will monitor the same thing. Well, I don't want to equate the same thing. They're not necessarily the same as an EKG, getting it in the hospital, but it's a quicker way of perhaps making an assessment, and that's what these wearable devices are tracking.
Any last thoughts?
I would always say one should be careful about these. It doesn't mean that you shouldn't treat that as medical advice necessarily. I would definitely talk to your physician. If you're an athlete, they might feel like they want to use this more. It makes sense to them because they're constantly active. But still speak to the physician, learn about these devices. Also understand what kind of data the device is offering. And also be aware that you are transmitting data back and forth. So that's something to be careful with as well. Who's storing this data? It is your health information, but one thing to remember is this health information that is being accessed by these wearable devices is not protected under what we refer to as HIPAA laws. So who's really accessing this information? Could they share this information with other third-party devices or apps? So those are things one should be careful about. One should read about it a little bit before kind of just sharing all this information on social media or anywhere else. So lots to think about, but at least something new on the horizon to keep an eye out on.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.